Did you know that 9 out of 10 seniors are really happy with their Medicare plans? That's great news. In fact, most people will tell you that Medicare coverage is the best health insurance they've had. So let's talk a little bit about what's covered and what's not when you switch to Medicare. Hey, this is Seth with the Decker team. Let's take a look at 6 things that Medicare doesn't pay for. And we're going to start with long-term care. So if you don't want to watch this whole video, I'm going to tell you right now the 6 things that Medicare Parts A and B don't pay for. 1. Long-term care. 2. Prescription drugs. 3. Dental plans. 4. Vision. 5. Hearing. And 6. Foreign travel. Now remember, when we're talking about basic Medicare, we're talking about your Parts A and B that pay for hospitalizations and doctor's visits. Now, since this does not cover those 6 items, if you add on a Medicare Supplemental plan, also known as a Medigap plan, they also do not cover typically those 6 other things. But there are some plans that do, or you can add on a dental plan, a vision plan, a hearing plan. Medicare Advantage plans often do have coverage for some of these, hence the Advantage name. But if you want to learn more about it, continue to watch the video and I'll get into some more details. You probably know that Medicare does cover care in a skilled nursing facility in certain situations, but this is not the same as long-term care, so you need to be prepared. Medicare only covers up to 100 days in a skilled nursing facility per benefit period, and in order to qualify for this coverage, your stay must be following an inpatient hospital stay, and you must need a higher level of care than just help with daily activities, like custodial care. If your skilled nursing facility stay is covered, there's a hefty $176 per day copayment, so you can purchase private long-term care insurance to help cover the cost of supportive care, and the earlier you buy this, the cheaper it will be. Unfortunately, too many think about long-term care once they already need long-term care, and usually by then, long-term care coverage is too expensive to purchase. But more than 60% of Americans will need long-term care at some point, so it's worth taking a good look at it. The other thing that original Medicare does not cover are outpatient prescription drugs, generally medications that are needed prescribed by a doctor, and not something that you were given in a hospital. So most of these medications are going to fall under Medicare Part D. Part D prescription drug plans. They are technically optional, but if you don't have creditable prescription drug coverage through an employer or the VA, then you're going to pay late enrollment penalties with your premium when you buy this plan later. So that is why most people absolutely buy Part D right when they enroll in Medicare, so that they have that coverage. Now, to note, Medicare Advantage plans typically include prescription drug plans as well. And one advantage of Medicare Advantage is that it's all included, it's built in. You get all the benefits in one plan for one premium, makes Medicare Advantage a convenient alternative for many people. However, the built-in drug plan may or may not include your medications in the drug formulary. So be sure to check this before enrolling in any Medicare Advantage plan. Now, the other thing that's not covered is foreign travel with original Medicare. There's just a few narrow exceptions where Medicare may pay. For example, if you're traveling between Alaska and the lower 48 states and you need emergency care while you're passing through Canada, Medicare may cover this treatment if you live near the border and a foreign hospital is closer than the one based in the US. So there's a lot of ifs, ands, and buts there. But typically, you are financially responsible. If you're a frequent traveler and you're a senior, this can be a major concern because one serious health episode could cost you tens of thousands of dollars in medical bills. Fortunately, there are a couple of Medicare plans that do include some coverage for foreign travel. And that emergency coverage is usually capped at $50,000. In addition, many foreign hospitals and clinics won't bill your plan, so you'll have to pay cash up front and then request reimbursement once you return to the States. Likewise, most Medicare Advantage plans also include coverage for emergency care outside the US, but again, foreign providers aren't required to accept your plan or your bill on your behalf. So it's almost always a good idea to buy a travel health policy if you plan to leave the country, and these are generally pretty affordable. The next thing that's not covered is dental. This is one of the things we get more questions on than anything. And frankly, most dental insurance plans just aren't that great. Medicare Advantage plans often include a dental coverage element, but those are usually pretty limited to about $1,000 a year, which if you've had dental work, you know that's not going to cover all the bills. But under regular Medicare A and B, Medicare only covers medically necessary dental services that you need to treat a health condition. For example, if you have oral cancer and you need dental surgery as part of your treatment, Medicare may cover that dental surgery under your Medicare benefits, and it sometimes does pay for routine dental exams if you need an exam for a clearance prior to heart surgery. But beyond those very limited services, they're not going to pay, and you're going to have to pay out of pocket. Fortunately, there are many companion dental plans on the market for seniors today, and these range from discount plans, standalone dental insurance plans, as well as health matching accounts, which are basically savings plans that help you build up your savings quickly so that you can pay for this dental care. Medicare Advantage often does include basic cleanings at no cost. The other thing that's not included is vision. Many seniors have cataracts, need eye surgery, they need some help with glasses, contacts, maybe they need retina surgery. So if you're diagnosed with cataracts, Medicare will pay for the surgery and one pair of corrective lenses. Afterward, any ongoing routine care after that point is not covered. And it's important to note that just because you have a Medigap or Medicare Supplemental plan in addition, it's still not going to pay for vision services unless it's paid for under original Medicare as well. 1/3 of seniors between the ages of 65 and 74 will need help with hearing aids, and over half over 75 are hard of hearing. Few insurance plans cover the cost of hearing aids because they're just so expensive. For example, an average cost is around $2,700 out of pocket for a pair of hearing aids. Medicare doesn't cover routine hearing care, so if you have difficulties with hearing, you can expect to pay 100%. You may be able to find a Medicare Advantage plan with benefits for hearing care and discount or allowances for hearing aid devices that may be a benefit included in the plan, or that you can add on for an additional premium each month. For some, choosing a Medigap or Medicare Supplemental plan and then adding on a dental, vision, and hearing plan may be the best option to get that all-in-one coverage.